Hello everyone, now let us discuss about 2023 ICD 10cm coding guidelines for Chapter 21, Part 4. Chapter 21 mainly deals with factors influencing the health status and contact with health services. It mainly deals with the Z codes. In the current session, we will be discussing about some of the status codes. Now, coming to what are status codes? A status code is informative because the status may affect the course of the treatment and its outcome. It is an informative code that may affect the course of the treatment and its outcome. And the status code is distinct from a history code because history code indicates that a patient no longer has the condition, whereas status indicates that he is currently having that particular susceptibility, or he's having a device in his body that is also indicated by a status code, such that a status code should not be used with diagnosis code from one of the body system chapters if the diagnosis code includes the information provided by the status code. This is important. A status code should not be used if that particular information is included in the diagnosis code itself. For example, code Z94.1 indicates heart transplant status. Code Z94.1 indicates heart transplant status, and it should not be coded along with T86.2, that is complications of heart transplant. Here in the code description itself, heart transplant is indicated or included. So additionally, you did not code a heart transplant status code, that is Z94.1. You should not code Z94.1 along with T86.2 because here the status code does not provide any additional information that is not included in the code itself. The complication code indicates that the patient is a heart transplant patient. And for encounters for weaning from a mechanical ventilator, assign a code from the subcategory J96.1, that is chronic respiratory failure, followed by Z99.11, dependence on respiratory ventilator status. Here, status code is required because the encounter is for weaning from a mechanical ventilator. For that reason, you need to indicate that the patient is dependent on the ventilator. The code is Z99.11. Now coming to Z14. Z14 indicates genetic carrier. Genetic carrier status indicates that a person carries a gene associated with a particular disease which may be passed to the offsprings who may develop the disease. And the person does not have the disease and is not at risk of developing the disease. He does not have the disease and he is not at risk. In such case only you can code genetic carrier codes that are Z14, that come under the category Z14. The next is Z15. This is a little different. Genetic susceptibility to the disease. Genetic susceptibility indicates that a person has a gene. Genetic susceptibility indicates that a person has a gene that increases the risk of the person developing the disease. And the codes from category Z15 should not be used as principal or first listed diagnosis. This is important point. They cannot be used as PDX. And if the patient has the condition to which he is susceptible and that condition is the reason for encounter, the code for the current condition should be sequenced first. And if the patient is being seen for the follow-up after the completion of the treatment for this condition and the condition no longer exists, a follow-up code should be sequenced first, followed by the appropriate personal history and genetic susceptibility code. They cannot be used as PDX. If the person is diagnosed, that diagnosis code should be PDX followed by genetic susceptibility code. If the person is completely cured, then follow-up code followed by personal history and then susceptibility code should be coded. If the purpose of the encounter is genetic counseling, if the reason for encounter is genetic counseling associated with procreative management, code Z31.5, that is encounter for genetic counseling, should be assigned as the first listed diagnosis. followed by a code from the category Z15. Additional code should also be assigned for any applicable family or personal history. The next is Z16 category. It deals with resistance to antimicrobial drugs. This code indicates that a patient has a condition that is resistant to antimicrobial drug treatment. So sequence the infection code first, followed by resistance code. The next is Z17, that is estrogen receptor status. Now coming to codes from category Z14, that is nothing but genetic carrier codes. The first one is Z14.01, asymptomatic hemophilia A carrier. The next is Z14.02, that is symptomatic hemophilia A carrier. Next code is Z14.1, cystic fibrosis carrier, and finally Z14.8, genetic carrier of other disease. There are 4 codes for category Z14. Next, category Z15, that is genetic susceptibility to disease. The first code is Z15.01, that indicates genetic susceptibility to malignant neoplasm of breast. The next is Z15.02. It indicates genetic susceptibility to malignant neoplasm of ovary. The next is Z15.03. It indicates genetic susceptibility to malignant neoplasm of prostate. The next is Z15.04. It indicates genetic susceptibility to malignant neoplasm of endometrium. The next is Z15.09. It indicates genetic susceptibility to other malignant neoplasm. Finally, Z15.81. It indicates genetic susceptibility to multiple endocrine neoplasia. MEN, multiple endocrine neoplasia. And finally, Z15.89. It indicates genetic susceptibility to other diseases. Now let us see an example. Patient with DCIS, that is ductal carcinoma in situ of left breast at young age, has gene testing and it comes back positive for BRCA1 mutation. So this is a gene which increases the risk for breast cancer. BRCA, BRCA1 mutation. So first, since the patient is diagnosed from the disease, D05.12, intraductal carcinoma in situ, intraductal carcinoma in situ of left breast, followed by Z15.01, genetic susceptibility of malignant neoplasm of the ovary. Now coming to Z16 category that deals with resistance to antimicrobial drugs. This will be discussed in chapter 1. So first coming to subcategory Z16.1. The first code is Z16.10. It indicates resistance to unspecified beta-lactam antibodies. The next is resistance to penicillin, resistance to amoxicillin or ampicillin. Whenever the physician documents any of these, the code is Z16.11. The next is resistance to extended spectrum beta-lactamase resistance. Extended spectrum beta-lactamase resistance, ESBL. This you will find regularly. The code is Z16.12. And finally, resistance to other specified beta-lactam antibiotics or resistance to cephalosporins also. The code is Z16.19. The next is subcategory Z16.2. First code is resistance to unspecified antibiotic or resistance to antibiotics NOS. The code is Z16.20. The next is resistance to vancomycin. The code is Z16.21. Next, resistance to vancomycin related antibiotics. That is Z16.22. Next, resistance to quinolones or fluoroquinolones is given by the code Z16.23. The next is resistance to multiple antibiotics. It is given by the code Z16.24. Next code is resistance to other single specified antibiotic or resistance to aminoglycosides or resistance to macrolides or resistance to sulfonamides or resistance to tetracyclines. If the physician documents any of these, the code is Z16.29. Next category Z16.3. The first code is resistance to unspecified antimicrobial drugs, or simply drug resistance NOS. If the physician documents drug resistance NOS, the code is Z16.30. Next is resistance to anti-parasitic drugs or resistance to quinine or related compounds. The code is Z16.31. The next is resistance to antifungal drugs. The code is Z16.32. Next, resistance to antiviral drugs. The code is Z16.33. The next is resistance to mycobacterial drugs or resistance to tuberculostatics. The code is Z16.34. The next is resistance to single antimicrobacterial drug or resistance to mycobacterial drug NOS. The code is Z16.341. Next is resistance to multiple antimicrobacterial drugs. The code is Z16.342. Next is resistance to multiple antimicrobial drugs. The code is Z16.35. And finally, resistance to other specified antimicrobial drug. The code is Z16.39. Now let us see an example. A patient is seen for Clostridium difficile colitis. The cultures of the organisms have found this infection resistance to fragile. It is a drug. A new drug regimen will be started at this time. So here first you need to code the infection A04.7, enterocolitis due to Clostridium difficile. And next Z16.39, resistance to other specified antimicrobial drugs, because flagell comes under the class of nitroimidazoles and you don't have a specific code for nitroimidazole resistance. So the appropriate code is Z16.39, that is resistance to other specified antimicrobial drug. Now let us see one more example. A patient is diagnosed with urinary tract infection due to ESBL E. coli. In this scenario, it requires three codes. The first code is for urinary tract infection, N39.0, followed by B96.20 for unspecified E. coli as causative agent, and then finally ESBL to indicate that Z16.12 to indicate extended spectrum beta lactamase resistance. ESBL means extended spectrum beta lactamase resistance. Now coming to Z17 category, it deals with estrogen receptor status. The first code is Z17.0. It indicates estrogen receptor positive status, ER positive. The next is Z17.1. It indicates estrogen receptor negative status. Let us see an example. Estrogen positive, stage 2 ductal carcinoma, lower inner quadrant of the left breast. Completed first round of chemotherapy. Follow up with patient after the next round of chemotherapy and repeat laboratory work. Here, first you need to code the malignancy, C50.312 to indicate malignant neoplasm of lower inner quadrant of left female breast, followed by Z17.0 to indicate estrogen positive, estrogen receptor positive status. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.